Good afternoon. I am Dr. Maya Bird Stewart, and welcome to our annual Health and Wellness Week.
Let's go!
We have a dynamic woman in the studio with us today, someone who is well known in the community, someone who serves as the chair of the Miami-Dade County Health Association, Medical Association. And so without further ado, we'd like to introduce Dr. Patricia Eres, also known as Dr. Patty, MD. Patricia.
Hi, thank you so much for having me. I'm so excited to be with you here today.
Absolutely. And so we know that we don't have a lot of time, and so I'd like to just jump into it. Dr. Patty, some of the things that you and I were talking before we started the podcast, and we were talking about just some of the issues in the community, some of the issues dealing with the communities as it relates to mental health, as it relates to stigma. A couple of the topics that I'd like for us to touch on this go round is telehealth, behavioral health services, right? What may be available, health information technology, HIPAA, or the privacy of our information. And lastly, AI-enabled tools, artificial intelligence. We know that that's the wave right now, and I shouldn't say wave, it's the way to go, it's a way of life. And so I'd like to just have you share with us, as it relates to telehealth, what are some of the resources that are available to those in underserved areas, right? And then the stigma that goes along with that, right? What are some of the ways that, we should challenge the stigma and not allow it to keep us so closed and closed-minded?
Sure. I mean, wow, that's a lot of things, right? So let's get started. So actually, it's quite interesting. I used to be the chief medical officer of Jackson Behavioral Health, one of the largest hospitals here in the Southeast.
Yes.
And telehealth really wasn't that available before COVID.
Mm-hmm.
It existed, people talked about it, some people did use it, but it wasn't really till COVID that it really exploded.
Okay.
And even healthcare agencies decided, hey, this is something that we need to fund, and we need to make sure that people have access, especially in those rural communities where it's so hard to find a provider. Appointments sometimes are 6 months out, a year out to see someone. And when someone's in crisis and someone really needs to either speak to someone, see someone, start a treatment plan, they need to be seen then, especially with the high incidence of suicide, especially in adolescents and young adults. So telehealth is a great thing. It's widely available. And when it comes to stigma, some patients prefer it, because they don't have to come into the clinic.
Okay.
Right? So some of those people that perhaps before were very shy, very scared, didn't want to think they were, and I put this in air quotes because I don't like to use the word, but it's said in the community, crazy, right? Because if I have to see a psychiatrist, which is not so, it's not true, I promise. Anybody can see a psychiatrist. All of us have either struggled with one of these issues or know somebody that has, so anxiety, depression, PTSD, especially after COVID. So it's great for that reason, right? It's wonderful that there is that tool that you're able to access those services. Now, when it comes to underserved communities, the one issue is, Wi-Fi. So some of these communities don't have access to Wi-Fi, so there's limitations there. Limitations when it comes to, for instance, if somebody just has a mobile phone and not a computer, and they might have limited time because of their plan. So they might not want to use it for that because they might need it for other emergency reasons. So those are some of the limitations that we really have to kind of really work on at, at a state level.
Sure. Wow. And I've never thought along the lines of what you're saying. So when I think about underserved communities, I'm thinking about ways that we can get the service in the community. But you bring up great points. Many times in underserved communities, the Wi-Fi or the resources, computers or not laptops.
Right.
Wow. And so I also like that you said that's something that must be dealt with at a state level.
State and federal level.
It's bigger.
Yeah, these are things that, we have to have the right laws in place where we're able to get those resources to the people that need it the most.
Yeah, and so some of the advantages of using or having telehealth, of course, and using telehealth is that it's basically a service that comes to you. And so whether
Correct.
you're in the house, whether you're in a park, no matter where you want to be, dealing with the stigma, you don't want people to know, you can always go to another location so
Right.
that,
Or even people that have struggles because of transportation.
yeah.
I mean,
Yeah.
you know, living in South Florida, we know how difficult it is. Public transportation is chaotic here,
Yeah.
right? So access to transportation is a big issue.
Okay.
Or sometimes patients are bedbound.
Yeah.
And they can't get to their appointments, and if they don't get to their appointments, they don't get their medication. If they don't get medication, it just kind of spirals, and they'll end up in the hospital.
Wow, yeah. Regarding telehealth, is it available in every aspect of healthcare? So, for example, during COVID, I had an appointment with my medical doctor. I had an appointment with with gastro. I had an appointment with, endo. I had an appointment with different departments, and we were able to do those appointments via, say, Zoom.
Right,
Zoom is
right.
an example of telehealth. Is that correct,
So
Doc?
they have
Or-
now a healthcare Zoom, which
Okay.
has privacy settings and things
Okay.
like that. And there are other telehealth services, but usually most practicing physicians don't use Zoom, the regular Zoom.
Okay.
But at that time, we really had the ability to whatever worked, if it was
Yeah.
FaceTime,
Yeah,
right? Because
yeah,
we needed to make sure
yeah.
our patients got seen.
And so you said something. So telehealth, the distinct difference between, say, telehealth and Zoom, is it the format or the platform?
So I think most physicians rather use something that's been certified as safe, just for HIPAA reasons.
Gotcha.
You don't want, and I know there was a huge scandal with Zoom at one point, a few years back,
Yeah.
that people were zooming into meetings that
Yeah,
they weren't allowed
yeah,
to be.
yeah.
And I think that was
Yeah.
resolved, right? But so I think those platforms are a little bit more
Okay.
used by practitioners as opposed to just a regular Zoom.
Gotcha.
For those reasons, for privacy, you don't want somebody jumping in when you're talking. Now, when the question comes to the different services during COVID, it was open pretty much to everything, and insurance companies and Medicare and Medicaid were paying for
Okay.
those visits. I know that after that, some laws have changed where not every visit will be paid if it's telehealth.
Okay.
And the other thing is also, usually with established patients, it's a little bit more acceptable. If it's a new patient, you usually want to see them for the first time.
Okay.
You want to do a physical exam,
Sure.
right? Because
Sure.
we still need to touch our patients and make
Sure.
sure they're healthy. So those are some cases, but sometimes after they've been established, you can go ahead and see it. I took my son to the ophthalmologist, and it was telehealth. You had the tech in the room, and the actual the technology is so amazing. I was amazed. It's so amazing where the ophthalmologist was home or wherever he was in his office somewhere, and he can actually move, those things that they kind of turn to
Yeah,
check
yeah,
your vision.
yeah.
He can do it from wherever he was.
Wow.
So I was really impressed, and there was just a tech with us in the room. So those are some of the advances that are wonderful
Wow.
for us. Yeah.
You mentioned security earlier,
Yes.
transitioning, health information technology, right? The privacy and the security of information,
Correct.
whether we, certainly if we're going into a facility, but if we're using telehealth or if we're using digital methods of attending a doctor's appointment. How does health information technology help to improve or certainly secure, in the most fundamental way, our information?
Right. So in most, if not all, of the larger facilities, there's privacy officers, and they are in charge of making sure that not only the data is safe, but actually those visits are safe. Because there's always, especially if you're talking to a psychiatrist and you're telling them the most intimate things that perhaps you would not share with
Yeah.
anyone else.
Yeah.
You want to make sure nothing's being recorded.
Absolutely.
Or no one's listening in, so that's why those kind of things there has to be standardized
Okay.
and put into place.
Okay. And so you said something recorded. I always thought that medical appointments no matter what room you were in within a facility. I always thought that they were recorded. Is that not
They
the
are
case?
not. They are not for privacy reasons. So you will have, so there'll be recording of common areas, and there should be a sign saying this area is monitored by surveillance. Some common areas are, but if you are going to a physician's office, you don't want to be recorded if somebody's doing a physical exam or anything like that. So yes, so there's lots of limitations when it comes to cameras.
Okay, and so when I think about electronic health records, right, EHRs as we call them, how do they enhance the efficiency as it relates to the delivery of mental health care? How?
So it's great, right? That's a great question. So, the advances have been when I trained, I used to have to write my records and my charts, and of course it takes a long time.
Sure.
And my handwriting got atrocious as a result from so much writing. But you're able to access things such as the pharmacy, right? Because sometimes a patient will come in and, what medications are you on? And they'll be like, oh, no, I just take Synthroid for my thyroid. And then, are you sure you don't take anything else? No, I don't. But then when you're able to access that from the actual pharmacy, you can actually pull the medications that they've actually picked up or they've had. So it helps in the treatment and safety, right? You don't want to treat a patient with a medication that might interact with something else.
Yes. Wow.
Other things like allergies. So if ever there's been any report of an allergy to any kind of medication, then you're able to see it as well. So I think that really for the reconciliation of medications and allergies and things like that is really a good safety mechanism that electronic medical records has given us.
Oh, wow. Okay, that's good. And again, I knew that I was excited about this session for some reason. Yeah, I had never thought about that from the standpoint of the medical personnel having access to the pharmaceutical information.
Sure.
Nowadays, many of the hospitals or facilities have an app where you can go and log in to your phone into your own records.
Yes.
You can see your doctor's appointments. You can see and so that's something too. Although we talk about the underserved community and maybe there being a lack of resources to internet or cell phone, that is a resource though that's available to everyone, right? Because if I'm not mistaken, you can also schedule through the app.
Yeah, so that type of technology has been really instrumental in getting patients to their appointments and even reminders, right? Because sometimes you might forget you have an appointment. But not only that, like let's say if I have a patient and they have a primary physician and they did labs, they come to see me for the first time, and I'll ask, when was the last time you had lab work done? And they can pull it up in their app, send it to me. That way I don't have to repeat the test.
Yes,
right? Because if you had it within the last month, 60 days, 90 days, and there's really no reason for me to run the test, I'm saving money to to the system.
Taxpayer money.
Right, we're saving money. Yeah. So that is great, right? Because they could just pull it up on an app and they can see the results. And they can have a good conversation with their physician.
Absolutely.
Right.
Wow. Yeah, that's awesome. And I keep going back to, again, just certainly underserved, but just big picture, right? Anyone that is, not abreast of the resources, right? I hope that that's what, we're able to do here today. And it, again, if you have a doctor and if you are attached to any of the major systems, whether it's a Jackson, whether it's a Baptist, whether it's a Memorial, they have the electronic or the system certainly where you can log into an account and see your absolute overall medical history, from pharmacy to appointments. And again, I think that you're able to make appointments. I don't know if through each of them, I know through Memorial, you're able to even make appointments, which would be a good way to enhance, at least in some way.
And sometimes you call a hospital or a clinic and it's really hard to get through.
Yes.
Right. And then
get
maybe
the runarounds.
Right. And then you miss the appointment and things like that. So I think, any kind of technology that really simplifies the patient getting to where they need to be, I think it's a win.
Awesome. All right. So last but not least, AI, artificial intelligence. Doc, I'm sure I don't have to tell you, certainly someone in your position and the role that you play from a big picture standpoint, artificial intelligence, right? We hear it, we see it, it's everywhere. It's in our classrooms, it's in our doctor's offices, it's in our professional offices, it's in our entertainment.
Yeah.
It's here to stay. How does AI play into mental health, the field of mental health? How does AI make a contribution? How does AI take away? Just the role of AI as you see it, you know it, and you understand it when it comes to mental health.
Sure. So there's been digital therapeutics around for a while, and
Wow.
that's kind of the nomenclature that we use. So digital therapeutics, and what they do is they help. So for instance, for ADHD, there was a digital platform where the kids would do the actual task. It's kind of like playing a video game. We're talking for young children that are diagnosed with attention deficit disorder, hyperactivity, and then it was like playing a game for them, or it is like playing a game, and then they would have to do these short sessions, 10 minutes times, and then they would do it, and they did it for 12 weeks, and the research showed that it was just as good as a stimulant medication doing that. And then many times if you combined it, it was even better results. You didn't have to have such a high dose.
Okay.
Digital therapeutics. So I think that's a great place to have it. There's other digital therapeutics that have been used with substance use disorder. So patients that struggle with alcohol or opioids, and it's kind of a cognitive behavioral health 12-week sessions, and then they have benefits from it. And so that's a great other place for digital therapeutics. Now, with the new wave of AI that we've been seeing in the last year, we've been seeing facial recognition, and so there's some companies that are coming out recognizing the face, and they have these algorithms to see if the patient is anxious or depressed or sad, and then it could be kind of a screening. I don't know if it's going to be complete diagnoses, but it kind of a screening, and it kind of flags if this patient might be at risk.
Wow.
So they might need an appointment earlier on. So there's a lot of things that are coming up that are very, very interesting. And I love it. I love it. I think, we've always have to be careful, right? Not to depend on AI 100%. There's a lot of things that they have to be clinician-based. But I think there's a huge space for them to be in medicine.
And so I was going to inquire about personalizing, right? How AI contributes to personalizing services. And I think you said it, the whole where you have to use the eyes or where you use the face to diagnose. Well, maybe, I guess not to diagnose, but kind of what you said.
Right, the
in terms of the
screening, kind of red flagging, bringing them up to kind of the queue because they might be a little bit more at risk. I think it's great. I mean, everybody's heard of ChatGPT. I mean, my brother's a CPA, and we were having this conversation the other day with the pseudo hurricane, and we're talking about. He goes, I can ask it anything. I just have to check that it's correct. Right, because sometimes he says he's found some errors, but he can ask just about anything, and it's a great tool. Now, if you're in high school, do not use it because you will get red flagged. Because there's technology to make sure that you're not plagiarizing. But it's a good place for learning. I mean, when I was a kid, it was a Dewey Decimal System. Do you remember that? You had to go and grab books out,
Absolutely.
And now we have it at the tip of our fingers. Whatever you want to know.
I'm not ashamed to say it. So I've used the AI, the ChatGPT, but I'm still very old school. I went to a meeting the other day, and I pulled out my paper and my pen, and I took notes.
I still take notes.
I looked at, I think I was trying to calculate something or understand something, and I picked up the calculator and I used it. And then I remember putting it down. Then all of a sudden I just remember I am old school, although I do appreciate technology today.
Yeah.
And so in closing, when we think about artificial intelligence, what is the threat, or is there a threat? Does it bring about any threat to us from a security standpoint, particularly when you talk about healthcare, particularly when we're talking about mental health records, right? Recognizing a person, whether he or she is in a crisis, or how does artificial intelligence, I guess, maybe create concerns for us as it relates to help?
Yeah, I mean, I think it's not the end all. So I think it's something that is a tool like anything else that we have in medicine. We shouldn't rely on it 100%.
Okay.
Right, so using it as a tool, I think we might have some challenges with patients who might be a little paranoid or suspicious or don't believe in advances. So I think it might not be a good thing. It might be counter intuitive to use with them. But I think, again, it's a tool, and I think we should use it when appropriate.
Yeah. Wow. Well, I again, Dr. Patty, I want to thank you because the information that you've shared is certainly information that I needed. I know, and I certainly pray that our viewers will find this just as helpful. We definitely need you to come back and share more. There are tons of topics that we know that you can help us with and educate us. And so, are there any last words, Dr. Patty, did you want to share with our viewers and our listeners?
Thank you. Just real quick, I think, it is mental health awareness, and I think we need to be aware that this can happen to anyone.
Yeah.
Anyone can struggle with anxiety, depression, even postpartum, kids, adolescents. It's okay to ask for help when we need help, and just reach out if you think somebody's struggling. Reach out to either their physician, their pediatrician. NAMI, the National Alliance for Mental Illness, all their services are free. I sit on their board, and there's always help. So don't be afraid, and don't let stigma stop you.
And so I want you to repeat one more time, NAMI, the National
Alliance for Mental Illness.
And all of their services are free.
All their services are free, and it's namimiami.org for the local chapter. But there's one in Broward, and there's one anywhere that you live.
Awesome. Thank you so much, Dr. Patty. We so appreciate you. And we'd like to thank those of you that have tuned in, those that are viewing our podcast, and those that are listening. We are looking forward to continuing throughout the month of October, and certainly during Mental Health and Wellness Week, to bringing you more information that we believe will prove to be very helpful to you. Again, I am Dr. Maya Bird Stewart, and we look forward to seeing you during our next podcast.